Hi everyone, and welcome to the fifth installment of Registered Student Organization Training at the University of North Georgia. This video was created by the Office of Student Involvement and is intended for RSO student leaders, RSO faculty and staff advisors, and anyone interested in the betterment of student organizations at the University of North Georgia. In this training, you will learn how to recognize common signs exhibited by someone struggling with a mental health condition and how to intervene in the case of a mental health crisis. You will also learn how to play an active role in reducing the stigma around mental health. Finally, we will provide you with mental health resources available at UNG and at the national level. Mental health conditions are more common than you may think. 1 in 5 youth or young adults live with a mental health condition. Do you know the warning signs, like feeling sad or withdrawn for more than 2 weeks? Severe mood swings that cause problems in relationships? Intense worries or fears that get in the way of daily activities? Sudden overwhelming fear for no apparent reason? Seriously trying to harm or kill oneself or making plans to do so? Not eating, throwing up, or using laxatives to lose weight? Significant weight loss or weight gain? Severe, out-of-control, risk-taking behavior that can cause harm to self or others? Repeated use of alcohol or other drugs? Drastic changes in behavior, personality, or sleeping habits? If you see these signs in yourself or a friend, tell a trusted adult. The first step to getting help is to say it out loud. A mental health crisis occurs when a person's thoughts or behaviors put them at risk of hurting themselves or others. A crisis also constitutes a person being unable to care for themselves or function effectively in the community. During the event of a crisis, it's most important to listen carefully and be gentle with any responses and expressions. You should approach each conversation with compassion and a willingness to understand. Speak softly and honestly, letting the person know that you are concerned and want to learn more about what they're experiencing. If they are unwilling to divulge the details of their experience, continue to be in calming presence. Simply being present during a crisis can aid in de-escalation. Offer support to the individual. Let them know that you are willing to help them take the necessary steps to establish their peace and comfort. Ask them how you can be of service to them during this time. Offer to walk them to the counselor's office. Continue to brainstorm solutions with the individual and encourage help-seeking behaviors. Finally, be a friend and regularly check in with those who may need support. Regular check-ins may reduce the chance for potential crisis situations. Strive to increase your own understanding of mental health. Avoid harmful phrases and let the individual know that you are always willing to be a source of support. While great strides have been made in the last several years in terms of destigmatizing mental health, there is always room for growth and improvement. You can continue to encourage meaningful conversations about seeking help in the following ways. Choose your language carefully. By using words that promote kindness and understanding, you can increase a person's willingness to talk openly about their experiences. For example, refer to mental health diagnoses as conditions rather than disorders or diseases. Disorder and disease carry negative connotations and are not considered person-first language. As another example, when talking about suicide, consider meanings your words may have. Committed suicide implies that suicide is a crime. You can help eliminate the misunderstanding and stigma that prevent people from speaking up and getting support by choosing words that are clearer and more neutral. Talk openly about mental health. If comfortable, share your personal mental health journey with others with the purpose of empowering others to do the same. Amplify the voices of those who are willing to share their experiences. Finally, note the lack of stigma surrounding seeking help for medical conditions. People see a doctor not only when they are ill, but also for preventative care. The same understanding and support should be extended to those who seek help for mental conditions. Individuals living with a mental health condition should be encouraged to receive care on a regular basis, not just when in crisis. The University of North Georgia has several mental health resources available to students. UNG Student Counseling offers a variety of counseling modalities and interventions that are free and confidential. Counselors can be reached using the information listed in the chart below. Additionally, UNG initiated a step care approach to assist students in distress. This model provides a variety of resources for individuals and an intervention structure that promotes resilience while encouraging an internal locus of control and a growth mindset. You can use the step care model to find helpful information and resources for a variety of issues such as academic distress, drug use, anxiety, body image, depression, grief, painful feelings, relationships and family issues, social identity, stress management, and trauma and abuse. You can explore the step care approach at the link provided on this slide. The University of North Georgia seeks to foster a climate of safety that requires the involvement of all university community members. To facilitate this process, the See Something, Say Something form has been provided to encourage faculty, staff, students, and other community members to report observed behavior that warrants concern for the safety of the community and the safety of the individual. These reports are reviewed by the university's behavior intervention team along with additional information to make the most informed decisions about how best to intervene and support the subject of concern. You can access the See Something, Say Something form at the link provided on this slide. Please look at the following non-UNG help resources that are available to you. You can also find these online at the link provided on this slide. Please reach out to the Office of Student Involvement or Student Counseling with any questions related to mental health. If you or someone you know has a life-threatening emergency on campus, call University Public Safety at 706-864-1500. If you or someone you know has a life-threatening emergency off campus, call 911 or go to the nearest emergency room.